Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, dengue or dengue, which is commonly pronounced, is a fever in a disease caused by a family of viruses that are transmitted by mosquitoes. And to know about the symptoms, causes, we have with us in our studio Dr. D. Patwari, who will guide us on the entire episode and brief us about the topics. So not to waste any more time, I'll straight away move to him and talk more about the topic which we have selected today. So Dr. Patwari, welcome to Good Life, the health show. It's a privilege to have you in our show. So the topic which we have taken up today is dengue.
Yeah.
It's a very commonly disease and it's been like, now we have again heard the news about dengue. It's been on the rise. So first of all, I would like to ask you, what is dengue? A brief note on everything that the viewers will understand about the topic.
Yeah, dengue is something new to us in our area. Initially, it started in the year 2000, in the year 1956. The first case of dengue outbreak was in the state of Tamil Nadu in the district of Vellore. Then there were some sporadic cases, but the rise came in the year 1996. There was an epidemic in New Delhi areas. It came to Assam late, in the year, later part of year 2000. So it's like a viral illness. So dengue is a viral illness. It is transmitted by the bites of mosquitoes, and most of the cases are asymptomatic. You will have a small prodrome of fever, body ache and headache, and the virus moves away. But in a few subset of patients in whom the disease increases, this is troublesome. So, so the problem is that it's a viral disease transmitted by mosquitoes, and initially the symptoms are like a common viral fever, like fever, headache, body ache, eye ache, and then it becomes some serious issues. All right,
doctor. And just for the viewers, I want to tell you that we are having a conversation on the topic that is, and the disease which we have taken today is dengue. And you can also call up us because our numbers are flashed on your television screens, and you can call and ask any questions. Dr. D. Patwari is here to answer all your questions on the related topic, that is dengue, which we have taken. All right, moving to the conversations, doctor, again. So if we talk about the signs and symptoms, so what are the earliest signs we can come out to know that a person is transmitted or a person is addicted to dengue?
See, to define a case of dengue, there should be certain symptoms. So suppose there is an outbreak of dengue in a particular area. So if a person who stays in that area, or if a person who resides or who travels in that area, and the symptoms develops within 2 weeks, then we may suspect that the patient may have a dengue. So ideally, it spreads by the bite of the mosquito. There is incubation period. That means immediately the patient will not have fever after the mosquito bites. So it takes about 7 days, plus minus 3 days. So from 4th day to 10th day.
So a span of 7 days is being taken.
Yeah. So this is called the incubation period. That means if a dengue mosquito bites me, immediately I'll not have a fever. So normal incubation period is about 3 to 10 days. Then I'll have fever, a high grade fever. It's common like a normal influenza fever. There will be fever, sore throat, pain in the eye. But there are certain pathognomonic signs of dengue. So if the patient fever is very high, the high fever, we see the patient temperature rising up to 103, 104. The patient will have a severe backache. The patient will complain of specifically retroorbital pain, that is the pain behind the eyes. So the patient will develop rash. So in those subset of patients, we have to suspect, yes, the patient was a resident of a dengue infested area, or he have traveled in that area. So this case might be a dengue, and this needs to be tested further.
So you were talking about the mosquito, that is the Aedes mosquito we are talking about. So when does that mosquito, and what kind of preventions one can take? So you have talked about the symptoms and the signs, that is the sore throat and also the fever, which is very basic.
Very common.
Which is very common. And everyone can be seen. And nowadays is the season of, like, we can talk about viral fever. So one has to be very careful, isn't it, doctor? So if we talk about the preventions, like how we have to prevent ourselves from not taking the prevention measures.
See, now this is a vector-borne disease. So the disease is transmitted, the disease is a virus which has been transmitted and amplified by the mosquito called the Aedes mosquito. So we have to discuss about the lifespan of the mosquito. The Aedes mosquito is labeled as an urban and semi-urban mosquito. So it resides near the household. So it does not fly to far away places. The maximum the flight distance is up to 400 meters. The mosquito breathes in plain water, plain clean water that is available in each and every nook and corner of the household.
All right. Doctor, just to interrupt you, we have a phone call and we'll just have to just go to the phone calls. So hello, who's calling from where?
जी मैं अजीत बोल रहा था.
हाँ जी बताइए. Welcome to North East Live. बताइए.
हाँ, थैंक यू। मैं डॉक्टर से ये जानना चाहता था कि अगर हमें शुरुआती जांच में अगर ये मालूम पड़ जाए कि हमारे मतलब शरीर में डेंगू के लक्षण है, तो हमें किस तरह की दवाई लेनी चाहिए, मैं ये जानना चाहता था।
अच्छा, धन्यवाद। आप नॉर्थ ईस्ट लाइव में आपने कॉल किया। सो डॉक्टर, ही हैज जस्ट आस्क्ड अबाउट द मेडिसिन
Yeah,
to be
definitely. The
taken
most
about.
important thing is that suppose you are suspected to have a dengue virus
Okay.
infection, do not panic. Rule number one is do not panic. Out of the 100 patients that develops the infection, only a few subset of patients, that is 5 to 10% of the patient, progress into a severe form of disease.
Okay.
So number one.
Okay.
So each and every patient that have a dengue, the symptoms of a dengue, whether it has been confirmed by laboratory test or not, they should not panic.
Okay. Only so first and foremost is you shouldn't panic.
You shouldn't panic.
Okay.
And second, the biggest fallacy, the biggest drawback is that those patients who are suspected to have a dengue, they are having high grade fever, they go to the pharmacy and take some painkillers because painkillers gives a rapid fall of the temperature and the pain goes down. And in those subset of patients who takes diclofenac, who takes ibuprofen, those subset of patients are more likely to goes into a complication phase like bleeding. Okay. So if you are suspected to have a dengue fever, do not do anything, do not panic, go to the nearest dispensary, go to a nearest healthcare center, and as of treatment of home, the only and the most important thing that you need to take for yourself is paracetamol tablets. Paracetamol tablet is the only treatment that has been recommended for treatment of dengue fever. It's a antipyretic, and the important thing is that he should prevent himself from dehydration. He should take plenty of fluids.
Okay, so plenty of fluid is very much
That
necessary.
is the most important thing, the fluids and paracetamol. Apart from that, nothing should be done. There is no medicine for dengue right now. There is no antiviral for dengue, and it's a self-limiting disease. That means the disease will limit by itself. And only, as I told you earlier, 5 to 10% of the patients, they get into complications. And because of the complications, even complication can be dealt properly, and the death rate of these complications is very, very low, only 1 to 2%.
Okay. So you were telling about that the basic symptoms about the dengue one can, and one should not panic. This is the first and foremost thing one of the viewers should know, that you shouldn't panic because doctors are there. If you feel like you have some basic symptoms are coming to you, and you can go to your nearby medical store or nearby doctor and you can have a proper diagnosis of that, isn't it?
Exactly.
So first of all, if any of the patient comes to you, doctor, with the symptoms of dengue, so what kind of like first and foremost treatment you do to that person?
See, first of all, we have to triage the patient. Not all patients require admission because the patient will take long queues in the hospital. They want to get admitted. The overzealous parents, my child is suffering from dengue, please admit him. So it should not be the rule. So we have to triage patients into 3 categories. One is the simple dengue. So this is a simple viral fever. We see the patient, we diagnose the patient, dengue, yes or no. Suppose the patient is diagnosed dengue. We see whether the patient is having any warning symptoms or not.
Okay.
I will discuss about the warning symptoms, but if the patient is stable, if the fever is not that much high, if the patient can drink and eat properly, if the patient blood pressure is okay, these subset of patients need not get admitted. They should come to the OPD in regular basis and they should check daily about the pros and cons of the disease. So this is one subset. As I have told you earlier, that there are certain high risk patients that needs to be admitted. By high risk, I mean the extremes of age, infants, young children, elderly patients, pregnant patients, patients of asthma, so patients of cancer.
Okay, doctor, I'll just interrupt you once again. We have another caller on the phone, so we'll just straight away move to the caller. So hello, who's calling?
Yeah, hi, this is Bibhash here.
Okay, yeah, hi Bibhash.
Hi, I just wanted to ask one question, sir. I'm such a layman, so I just needed to confirm what are the symptoms of dengue. I'm not too well aware because I hear about these are the symptoms, so I get a bit confused actually.
Okay, okay. So you want to know about the symptoms. So he wants to know about the symptoms because there are really many talks.
Definitely. Now we live in the endemic area. This is the endemic zone of dengue. So we suspect a patient to have a dengue or dengue if the patient is having high rise of fever with the 2 or more followings. So these are the 2 other subsets. Suppose if the patient is having a severe pain behind the neck, pain behind the eyes, severe backache, the patient is having severe pain abdomen, the patient is having rashes, the patient is having a bleeding gums. So these subset of patients, if the patient, as I told you in the early part of the show, if the patient resides in the endemic zone or if the patient have traveled to the endemic area and if the patient have 2 or more of the symptoms, these we diagnose not as a case of dengue but as a probable case of dengue. Then we need to go to the nearest healthcare center to get our blood tested. and which I believe is done free of cost in all the government hospitals and PHCs.
Okay. So if we talk about dengue, so is there what kind of like platelet counts we talk about in this? So what is that platelet count? Please just brief us about that.
The two most important things, since I have the opportunity to serve in the Hayat Hospital, which is located in one of the endemic areas in Guwahati, that is in Kahilipara, we see lots and lots of dengue patients for the last 3-4 years. Almost 1,000 patients per season we have been seeing it. And almost all the patients have been panicking about the platelet count.
Okay.
So the platelet is a part of the blood. So in blood we have got 3 main types. One is the WBC, or the white blood cells, which are effective in prevention of infection. One is RBC, which the red blood cells, which carries hemoglobin, and third is the platelet. So platelets are the things that prevent clotting, prevent blood loss. Suppose if I have a cut, so there will be oozing of the blood from my cut site. So platelets will form a net, and it helps in clotting of the blood.
Okay.
So the basic function of platelets is blood clotting. Okay. So in dengue, it's an inherent disease. Because of the virus and the disease per se, there is a tendency of the platelets count to fall. So normal platelet count is 1,50,000 to 4,50,000.
Okay.
So in dengue, the platelet count starts to fall in the convalescent period. That means there is a 3 phase of dengue. One is a febrile phase.
Okay.
During the febrile phase, the patient will have a high rise of temperature, as I told you earlier, body ache, headache, and the fever stays lasted for generally 4 to 5 days. In most of the disease, or most of the illness, or most of the viral infection, once the fever subsides, patient starts getting better.
Okay.
But there is a catch in dengue.
Okay.
So once the fever goes down, there is a critical phase. The next 48 hours is the most critical phase.
So one has to be very careful in that moment.
Exactly, because most of the patients, I see some of my patients roaming around in day 4. What is sir, kya hua? Sir, my fever is gone, now I am roaming around.
So one should not think that everything is like normal, but you have to take a lot of precaution. So doctor will come back to that topic once again. We have another caller right now. So hello, who's calling?
Yes, I'm Karina Kashyap from Assam. So may I know what are the food habits if someone is suffering from dengue?
Okay, you want to know about the food habits. Okay, so she wants to know about the food habits. Thank you for calling. Okay.
See, there is no particular food habit that has been prescribed for dengue. As I told you earlier, the patient should prevent himself from dehydration. So the patient should take adequate amount of fluids, be it in the form of fruit juice, coconut water, lime water, ORS is the best, any form of soup. So there is no such a particular ban that you are not supposed to take that food, you are not supposed to take this food. But the dictum is that once the patient is having a viral fever, his appetite will be lost and there will be some disturbance in the GIT. So it is advisable to take bland food as much as possible, but this is not the law. If you can digest, you can take any food, but the most important thing is you should prevent yourself from dehydration.
Lots of fluid is very much essential.
That is the most important. The only thing that has been shown to prevent the life of the person, to help in the convalescence, is to avoid of dehydration. It should be.
So is it the reason that the body becomes dehydrated at this point in time and one has to take care of all that?
No, actually there is another term which I'll tell you later on, because this, as I told you earlier, there is some subset of patients who deteriorates. There is a term called dengue hemorrhagic fever. There is a term called dengue. In dengue fever, in some subset of patients, there is a loss of fluid from the blood vessels into the body cavities.
So for which one has to be very proper about the fluid intake.
Yes. So fluid, we cannot predict that this patient is going to go into that thing. We cannot predict. That's why I have told you the reason. The patient should be monitored daily. His pulse, BP, hematocrit, platelets should be monitored daily. And patient should be adequately hydrated. And if we find that the patient is having signs and symptoms of capillary leak, there is a leakage of the fluids from blood vessels into the body. So these patients must be immediately admitted and should be given fluid for the veins.
Okay. So every day what has to be done is that everyday observation is very important for the patient, because things might change, things might improve, or things might changes might evolve any time. So one has to be very careful, and the most important point which you have mentioned, doctor, is that one should not think that if your fever is okay, then everything is okay. You have to be a very
Next 2 days is the most crucial period, because during this time the platelet count falls. So we are talking about the platelets. So we have deviated from the topic. So as I was telling you, the normal platelet count is 1.5 lakhs to 4.5 lakhs. So in dengue, the platelet counts will fall. Some patients, the platelet count falls rapidly. In some patients, platelet counts do not fall that rapidly, and that is the reason why we need to check the platelet count on a daily basis. And sometimes we check it from twice a day. So if the platelet count falls below 30,000, this is a warning bell.
Okay, okay. So, doctor, we have another call.
Yeah.
Okay, we'll just take the call. Hello? Hello? All right, the phone line is disconnected. So we'll continue with our topic. We were talking about the platelet count, which is also very important. One has to have a knowledge about it.
People panic about the platelet count. People keep on panicking about the platelet count. Normally, if the platelet count is less than 10,000, instructions are there, we have to give platelet transfusion prophylactically. But in some subset of patients whom we see the platelet count is falling rapidly, say suppose today the platelet count was 1 lakh, tomorrow the platelet count falls to 30,000 and the patient is showing signs of bleeding, bleeding from the gums, bleeding from the nose, bleeding from the stomach, then we need to give platelets. Apart from that, there is no need to panic until and unless the platelet counts falls below 10,000. Otherwise, there is no need to panic.
Only a small, can be sorted out.
Yes, only a small subset of patients will require platelet, and most of the patients who comes to the hospital, they keep on panicking about the platelets.
Because they hear from somewhere else. One is not having a clear-cut notion.
Exactly.
That is the thing. So, doctor, on that note, we'll have to slip into a short break. So, viewers will slip into a short break, but do come back soon. We'll continue with our conversation on the other side of the break. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and I was having a conversation with Dr. D. Patwari, who was talking about dengue. I'll move away to him and talk more. So, doctor, earlier to the break, we were talking about the signs, symptoms. So, now I would like to ask you about the warning signs.
Yeah.
So, that's a very important thing to know about.
As I told you earlier, all the patients who have dengue or dengue does not require admission. So, we have to call the patients daily. On daily basis, we have to see the patient, and there are certain warning signs which may predict that the patient is going to deteriorate. So, if the person is not able to take properly, if the person is having a severe bouts of vomiting, if the person is not taking properly severe bouts of vomiting, if the patient is complaining of pain abdomen, if the patient is having some altered sensorium, the patient is dizzy, not talking well, if the patient's urine output is gone down, and if the patient's liver is enlarged, and if the patient's, suppose the platelet counts are falling drastically, and if the hematocrit, that is a blood test, which is on the rise, if the patient's blood pressure is going low, that means these are the subsets which have the high propensity to develop into a severe form of dengue, and these subsets of patients needs to be admitted as soon as possible.
Okay, so these are very much important things one has to keep in mind, isn't it? So, doctor, if we talk about the natural process of like treatment, so we heard about it, papaya leaf is one of the major source of like curing treatment of dengue. So, how far is it true, and what can be done?
Yeah, this is the second most important question each and every patient asks. One is about the platelets, which we have discussed earlier, and second is about papaya leaves. See, so far as the treatment goes, the treatment protocol goes, these treatment protocols are given by us by the WHO or by the Indian government. So, till now, if the new guidelines have come, I'm not aware, till now we don't have any guidelines regarding the use of papaya leaves in dengue fever. However, there are some small studies in certain parts of India which are done in a few subset of patients, almost 200, 300 patients. In the recent studies, they have shown in the test that some form of the papaya leaves may increase the platelet count, but these are still in the initial phase. As of now, because since I told you I was practicing in an area where I have seen so many of dengue patients in the last 3-4 years, more than 4,000 patients, not a single patient I have prescribed papaya leaves, and touch wood, almost all the patients have recovered without the use of papaya leaves. So, as of now, I am not telling that we are not supposed to use it, but from my experience, it makes no such clinical difference until and unless we do some more tests needs to be done, and there should be a proper guideline regarding the use of papaya leaves. Of course, the major side effect is that the patient taking the raw papaya leaves complain of vomiting, nausea, and in that case, if the patient is vomiting, if the patient is not taking orally, we have the problem of dehydration.
That's because of the lack of knowledge, because they heard from somewhere that papaya leaves is
internet
good for
and
dengue.
WhatsApp has been flooded with the use of these papaya leaves, but still now I do not think so there is any guidelines regarding use of papaya leaves.
So, proper suggestion can be given to those patients and the family members of those patients that what can be used, and best ways to go to any of the doctor and have a proper diagnosis.
This is a simple,
and treatment is there. I think now the treatments have already come
up.
The
treatment is very simple. We do not need costly antibiotics. We do not need anything. The test is done free in the government hospitals. what we need to take is a paracetamol tablet that costs a few 1 or 2 rupees and ORS, nothing else. There is no costly medicine, nothing is required, and 99% will recover fully.
Okay, okay. So, and doctor, if we talk about the fever, the dengue fever, one feels like it's very dangerous. Okay, we'll talk about that, but I'll just have a call because there is a caller on the phone. So, hello, who's calling?
Hello, I'm Benita.
Hello.
I'm Benita. Actually, I want to know about some personal and household protection in dengue.
Yeah, that's a very good question.
Okay, thank you, John. Thank you so much for calling. Okay, so she's asking about the personal household things, how to take care of.
Exactly.
Okay.
See, we have to know the natural cycle, how the disease spreads. This is a vector-borne disease. So, we need to know how the disease spreads. Suppose I am suffering from dengue. Okay. So, my body is now full with virus.
Okay.
So, the Aedes mosquito will come and bite me. When the mosquito bites me, from my blood, the mosquito will also suck in the virus. And that virus multiplies in the midgut of the mosquito. It multiplies into thousands and millions of viruses. And after a span of 7 to 10 days, that mosquito becomes an infected one, and it will keep on biting all the other patients, all the other persons, and it's going to spread. So, from our household perspective, how to prevent the disease, we should keep the patient. Suppose I am having a dengue, I should make sure that from my side not a single mosquito bites me, and so that I can cut the viral circle. So, whatever we advise, since this is a daytime biting mosquito, most of us people take a nap in the evening, or if the person is sick, he stays at home. So, we ask the patient to sleep during the daytime using mosquito nets.
Okay.
From that
so
side,
those are the precautions one has to be
this is the precaution that one has to take. So, from my side, I will not allow any mosquito to replicate, number one. And secondly, this virus does not spread from like an aerosol. Suppose you have an influenza, I am coughing in front of you, the virus spreads from my aerosol to you, it does not spread like that. It spreads by the bite of mosquito, and once we can cut off the mosquito bite from me to the another mosquito, that will prevent.
Okay, okay. So, one has to be very careful, and the thing is, like you mentioned about the mosquito net, if suppose the house is transmitted and the area is very much in very leafy area and the mosquitoes are too much in that area, so one has to be very careful, and especially with the kids, because they sleep at any time, and one has to be very precautionary about them, and they have to use mosquito nets in daytime as well.
Yeah, because it's a daytime biters.
Yeah,
and the kids, when they go out, even the adults, they should cover their hands with using full sleeve t-shirts.
So, these are little precautions, and we will talk about the precautions, doctor, but right now we'll have to slip into a break. So, viewers will slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and I'm in conversation with Dr. D. Patwari, and I'll talk more about dengue. We were talking about the symptoms, signs. Let's talk more about the disease. All right, doctor, coming back to you. Earlier to the break, we had a lot of conversation. We talked about the warning signs also, and also about the papaya leaf, which is also everybody's in mind. So now if we talk about the ladies who are pregnant, if they are transmitted to dengue, so what is the solution to that?
Again, I told you earlier.
Because they can't have any kind of medicines on that time.
Paracetamol, the same treatment will be the same, but they belong to the high-risk patient.
Okay.
The high-risk patient, I told you earlier, the elderly patient, the younger patient, the pregnant women are very highly susceptible to the disease because they are carrying two lives, one herself and one another is a baby.
Yeah.
So, if the pregnant patient is having a suspected or having a dengue fever, we need to keep a close watch on the patient.
Okay.
And secondly, if during the time of delivery, a few days or few weeks before the time of delivery, this is the most crucial period because it has been seen in some subset of patients, the virus directly transmits, but the percentage is very, very low. Okay, it's not that each and every pregnant patient who is suffering from dengue, the virus will be transmitted to the fetus. But in some subset of patients, in some studies it has shown to 1%, in some studies it has shown 20–30%. Anyways, so the newborn will be affected directly. And in some subset of patients, the problem of dengue is that there are 4 types of subsets of dengue, dengue 1, 2, 3 and 4.
Okay.
So,
Four types.
if there are 4 types. So, if I suffer from dengue today, suppose subtype 1, I will be immune to dengue 1 for the rest of my life.
Okay.
But I will have a warranty period or window period of about the immunity of the 2, 3 and 4 for the next 3 or 4 months. And subsequent, the patients who deteriorates are most of the patients that deteriorates are because of the second hit of dengue.
Okay. So
not the first hit.
Not the first one.
The first one is generally asymptomatic or generally a milder form of disease. But second attack, suppose last year I have a dengue, I suffered from dengue 1. Today I am suffering from dengue 2 because of the antibodies that have been present earlier. So I have a more dreaded form of disease. So it has been seen that the second hit or the third hit dengue is the most severe and the most serious one. So suppose the patient, the pregnant woman, she develops an antibodies and that antibody has been transmitted to the via the blood into the fetus. So if the fetus develops dengue, then it's more difficult. So the chances of a complicated dengue in the newborn will be very, very high.
But there is nothing to worry, at least in the initial stage when they come to know about dengue, they have been
The treatment will be the same.
Treatment will be the same, but at least some other precautions will have to be taken.
Yes, exactly. And there is no correlation because suppose the mother is having a very severe dengue, it does not mean that the child will also have the severe dengue. It does not correlate to the severity of disease, but it is a special category of patients. Pregnant women should ideally be screened, should ideally be treated in the hospital with regular.
Okay. And sometimes what happens is the symptoms which you are talking about dengue, it is very much similar to the other symptoms, normal viral fever or something kind of. So how will a person come to know, and in initial stage, how is it like important for a patient or the person who is knowing about the signs and symptoms that they should immediately go and see a doctor to find out? Because nowadays people are very much cautious about things.
But the plus point is that the very important thing is that, which is a very good thing that I must say kudos to the health the department and the government, because until last year we have been seeing thousands and thousands of cases of dengue. But till now, I have not seen a single dengue patient in our area. And this is a very, very good sign. It's a very, very healthy sign because once the disease spreads, it's very difficult to curtail it.
Very true.
So in my area, I have not seen a single dengue case till now. This is the peak season. And if God helps, we will not get a single dengue. And I talked to some of my colleagues, they have said that compared to last year, the percentage of dengue in Guwahati is very, very less. In fact, I just asked one of my friends, he told that he has total number of cases we have seen now. I don't think so it will be more than 10 or 12.
Okay.
So this is a very good initiative that done by the government of prevention of disease. And it goes in a long way of explaining about the disease, creating awareness among the public, hosting TV shows, giving ads in the newspaper regarding the how to prevent the disease, what are the symptoms. So regarding the symptoms, as I have told you earlier, so we suspect as a patient to have a dengue if the patient resides or stays in the dengue area. Now we are not having a single dengue case in Lal Ganesh area. So if a person comes with a viral fever, I don't ask for.
So it depends upon the locality where it spreads, and you have to be very careful about that.
It's a viral fever, as I told you earlier. It's most of the cases, 70% is a normal. Suppose if a mosquito bites me, suppose if I have a dengue also, so it will not go into full-blown dengue. So it's a viral fever. So patient comes, don't take any, do not worry, do not take any painkillers, take plenty of fluids, paracetamol, but if the fever does not subside, we may think of doing a dengue test.
All right, doctor, we'll talk on that. We'll have another caller. So hello, who's calling?
मैं मिताली बोल रही हूँ.
अच्छा, बताइए.
तो मुझे फीवर है, तो 2-3 दिन से फीवर है, फीवर कम नहीं हो रहा है और फिर ये सर पे भी दर्द है और थोड़ा तबीयत भी बहुत ज़्यादा खराब हो रहा है, बहुत वीकनेस फील हो रहा है. तो मुझे मतलब लग रहा है कि थोड़ा बहुत ये सिमिलर की है डेंगू का जो ये.
तो आपको लग रहा है, अच्छा, सिम्टम्स आपको उस तरह के लग रहे हैं.
हाँ, तो क्या कैसे मुझे पता चलेगा कि है या नहीं, कैसे होंगे बेसिक ये कौन सी बातें जो मतलब जिससे मुझे पता चले कि मुझे डेंगू हुआ है या नहीं.
ओके, थैंक यू फॉर ओके. बिल्कुल हम डॉक्टर से अभी जानेंगे. थैंक यू सो मच फॉर कॉलिंग. सो शी इज सेइंग दैट शी इज हैविंग फीवर. In fact, she is having a like eye pain as well. And
but these are all symptoms as common as a viral fever. So suppose if the patient is having a fever, if she is having a common cold, if she is having a running nose, so this is a influenza. A simple viral fever.
Okay.
Suppose you are having a fever, if you are having a severe bouts of cough, it might be a lower respiratory infection. You are having a fever, you are having a burning maturation, that means a urinary tract infection. Not all fevers are dengue. That's true. But if you don't have all those symptoms, if the headache is severe, if you are having a severe backache, these two are very pathognomonic of dengue. You are having a severe headache, not in the back, but behind the eyes, retroorbital headache, and pain in the back. So it's the another form of dengue is a breakbone fever, severe pain at the back, and if you are having rashes in the body. So how to test for rashes? Just hold the arm or behind the back, give some pressure, wait for it. If there is rashes, so that means the patient, these are the signs that goes more in the favor of dengue. Then you should go to a nearest healthcare center and do the test for.
Okay, so the thing is like that if there are basic like symptoms are coming out and people are thinking that they are having dengue, so they can clear out their confusion and go to the doctor and have a proper checkup, isn't it?
Yeah,
so they can also be cleared about, because people are having a notion, they think about, they hear about dengue is being spreaded out, so maybe whenever they are feeling a feverish kind of thing and they are having some kind of signs regarding related to dengue, so they might think that they are having dengue, but better thing is that you should go and have a proper checkup, isn't it? And if we talk about the hygiene, doctor, we have to be very careful about the hygiene we have to maintain, isn't it?
See, charity begins at home. This is the most important thing. So you cannot blame about the government, you cannot blame about the municipality, they are doing nothing. You should start with ourselves. Number one, we should keep our own area clean. Irrespective, suppose if I stay in house number 4, I will not expect that suppose there is some mosquito from house number 5, they will come and bite me. So every individual should have a own responsibility to prevent the spread of this disease, because the mosquito will not bite looking by your skin color, caste, creed or a social status.
Absolutely.
So each and every household should make sure that they don't keep any stagnant water. Even if there is some provision of stagnant water, suppose you are having a plant tub, suppose you are AC coolers, the water should be replaced every 1 weekly. Every 7 days minimum, with maximum 7 days you should keep, and you should discard it.
So that doesn't need any other effort, because this is the thing which can,
this
we
is
can
free
do
of cost.
easily. It's a free of
cost. Yeah, free of cost.
And
the other remedies like spraying, use of DDT and mosquito repellents. And if the patient who is suffering from dengue, he should sleep in the inside the mosquito net, and we can prevent ourselves. Suppose there is an outbreak of dengue in the community, so I should always wear full sleeve shirts and full sleeve pants, and I should not sleep outside without any net. In that way, the vector, the entire transmission process will stop. So we can have a dengue free.
That's right. In short, it's like the proper precaution is very important.
Absolutely, this is the most important
confusion, if you have, there are doctors out there, you can have your confusions cleared. And if you feel like that you have getting the signs of symptoms and signs of like dengue, you can now go and have a proper checkup, and doctors are there. So doctor, we are very short of time. On last note, what would you like to tell the viewers of Good Life?
Exactly. Number one, as I told you earlier, we are talking about this disease dengue. So do not panic. If you are having a fever, do not take anything from the pharmacy, especially painkillers. If you are having a fever, headache, take paracetamol tablets. Go to a local doctor. This is not a safe, do not panic. This is not a very severe form of disease. Always, suppose you are, even if you are suffering from dengue, do not panic. Regular checkup, and most important thing is this one, avoid dehydration.
Avoid dehydration. So I'm sure the viewers who are watching this show, you must be having a clear-cut idea, and if not clear-cut, but at least some confusions of yours has been cleared, because we were joined by Dr. D. Patwari. So thank you so much, doctor, for coming to our show. It was a privilege to have you in our show, and I'm sure right now the viewers who are watching our show must be clear of some of the confusions which they have in our mind, and I'm sure the viewers, you must be clear, because these are the signs and symptoms which are very common and seen in the one who are being detected with dengue. So you can have any time, you can go to any of the doctor and have a proper checkup, and the medicines which the doctor has prescribed, these are very easily available, but one should not have it without the concern of any of the doctor. But on that note, we'll slip into a short break, but do come back soon, because we have lots more on the other side. Welcome back, viewers. You are still watching Good Life, the health show with me, Pooja, and it's time now to move on to a subject which plays a very crucial role in our lives. In order for our bodies to function properly and stay healthy, it is very important that we follow a good nutritious diet. And today the topic which we have taken to discuss is diabetes And to discuss, we have our nutrition expert, Tina Baby Borwa. So Tina, once again, welcome to Good Life, the health show. So today, the topic which we have taken, diabetes. And the viewers, once again, I'll let you know that our phone lines are open and the phone numbers are flashed on your television screen. So if you have any queries or if you have any questions on the topic diabetes, you can ask us. And Tina is here, our nutrition expert. She will answer all your queries. So Tina, coming back to you again, diabetes, a very common term we see in every household these days. So diabetes, we'll start with just a brief discussion on that, and then we'll talk about more. So diabetes, what you will talk on that, first of all?
Diabetes is a very, as you have said already, that is a very, very common term. In every household, among 5 members, we will find that 2 are nowadays diabetes. It is when the insulin secretion in our body is not sufficient or completely it's stopped, so the blood sugar level in the blood increases. So at that time a person may be termed as a diabetes. So it can be type 1 or type 2, which is generally categorized. Type 1 is non-insulin dependent diabetes and type 2 is insulin dependent diabetes.
Okay. Okay.
And the symptoms of diabetes are like increase of thirst and increase of urination, which are very, very common, and there may be blurred vision sometime.
Okay.
So these are symptoms of common symptoms of diabetes. And if it is untreated and if someone neglect, then it may lead to very, very serious health hazardous. Like one may have renal failure or cardiovascular diseases like stroke and all can have.
Okay.
So it is very important that one should have proper knowledge and should go to see a physician at a very first note.
Because whenever they get an early signs and symptoms
Right.
about diabetes,
Right.
so one
They should not neglect.
Yeah, one should not start their diet on own, isn't it? So
Yeah.
I will talk about the diet as well, but we have a caller right now, Tina. So hello, who's calling?
Hello,
Yeah, hello.
I am Pranjal from Guwahati.
Okay.
I want to know ma'am, about what type of diet or nutritious food we have to be taken during as a diabetes patient.
Okay, so you want to know about the diet. So thank you for calling to Northeast Live. So he wants to know about the diet and the discussion we are going to continue now. So a proper diet for a diabetic patient. So what would be that?
Yeah, there are certain things we have to notice while planning a diet for the diabetic patient. That is whether the patient is type 1 or type 2 diabetes.
So first that has to be known.
Yeah,
Okay.
that is because for both type 1 and type 2, the plan will be different. So if someone is type 2 diabetes, we have to adjust the food amount. The portion size will be adjusted with the insulin doses. So if the insulin dose is more and if the food intake is less, so the person may have hypoglycemia, which is a very, very dangerous sign. So because of that, we have to adjust this food portioning along with the insulin dose. This is one thing. And then number 2 is that we must give some exchange list to the patient so that they may not feel monotonous by following a diabetic diet, because they have to follow it lifelong.
True.
So variation should be always there in terms of like any kind of vegetables you are giving to the patient, that preparation should also be given them the taste, the appealing, they should feel like taking. And next is that the amount of food they are taking at a single meal.
Okay.
That has to be, that has to be arranged in a proper manner, and in terms of like it should be balanced.
Okay, so Tina, you were talking about, and we were talking about the diet, and it shouldn't be like of the same thing, because the person might get bored also, and it might not feel like to have those things. So there should be some of the variations in their diet plan, isn't it?
Right.
So if we talk about whatever the notion and normal people are having in their mind is that does having a lot of sugar is created to diabetes?
Yeah, you can say that, because if the person is having too much of sugary food items, and it depends, if your body is supplying that much amount of insulin, you may not get diabetes. But if you have a family history or if your lifestyle is not very active and if your weight is in a higher side, And at that note, you can say that a person may have or may get into diabetic by having too much of sugary food items. And there is also one thing, we have to know how much calorie a person need on regular basis to maintain a healthy life, because the calorie need of each and every individual differ. The amount of calorie I need, you may not need that much, you may need little less. So it depends upon the type of the food you are taking, and also your lifestyle. It matters a lot. You know, a very active person who is diabetic, we cannot give them very less calorie dense diet chart. So we have to adjust it according to the lifestyle also.
According to the lifestyle. That's very important.
That is very, very important.
And we have also seen diabetes has been seen nowadays in very much of the young kids out there.
Right.
So what could be the reason for that? Is it about the obesity or something else? Or what could be the reason? It is about the lifestyle you are talking about, because nowadays lifestyle has totally changed. The food habits, the way we sleep, or it's just like the time we are giving more to gadgets. So is this the reason, or
yeah,
what
it
would
is
be the
one
reason?
of the reason like that, because many of us we stretch nowadays more on studies. So physical activity is becoming, you can say, zero. So in that term, so the amount of food that we eat, that has to be absorbed in your body, and that should be utilized. So the amount of food that you eat and the amount of energy you expend, that should be balanced. If there is imbalance between both of them, then there may be obesity or maybe malnutrition. So means underweight.
Okay.
If your intake is less and if you are more active, then there may be, you know, you may not be, weight may not be accurate.
And if we talk about the physical exercises, how important is physical exercise for a diabetic patient? Is morning walks, if we talk about morning walks and like physical exercise to be taken up, because the person becomes too tired quickly. So what is the way for that, way out?
Yeah, well, at least we recommend for 30 to 45 minutes of physical activity early in the morning. If not possible, then can be in the evening time also, one has to go with that.
Okay.
But one thing I would like to tell, that if someone is diabetic and on insulin, it is recommended that you should not go on empty stomach for a walk. Because whole night you will be on a fasting stage, and morning, if without taking anything, if you go for a physical activity, again there may be chances of hypoglycemia. So so it is recommended that at least a cup of warm water, or you can take a cup of black tea or green tea, and then you go for your walk. But it should not be you know, on a very higher frequency. That your treating physician should recommend you that how much amount or how much time or frequency of walk a diabetic patient must go with.
Okay, okay. So Tina, these are the signs. One shouldn't be like worried about it, because if they are prone to diabetes. So we'll talk more, but we have a caller, so we'll talk about that. So who's calling? Hello? Hello? Kune koise?
হয় মই বৰ্ণালী কছাৰীয়ে কৈছো
আচ্ছা কওকচোন আপোনাৰ প্ৰশ্নটো
হয় মই মানে টিভিত টিনা মেমৰ প্ৰগ্ৰামটো দেখিলো মই মানে গেষ্ট্ৰাইটিছৰ বিষয়ে আগতে এটা শ্ব চাইছিলো সেই বিষয়ে মই অকমান জানিব খুজিছিলো আজিটো ডায়াবেটিছৰ বিষয়ে দি আছে
আপোনাৰ প্ৰশ্নটো কৰক
হয় প্ৰশ্নটো মানে গেষ্ট্ৰাইটিছৰ কাৰণে ধৰক মই জানিব খুজিছো যে কেঁচা আমলখিটো মৌৰে ৰাতিপুৱা খাব লাগে নেকি কেঁচা আমলখিৰ ৰসটো
আচ্ছা Kesa amlokhi rock to more. Acha. So Tina, she has asked a question. So can you please reply her?
Yeah, I can tell that you know, there is nothing written evidence that if you take amla juice early in the morning in an empty stomach, your gastritis will be cured. So in my in the last episode when we talked about the gastritis, I have stressed on some of the point that gastritis is due to your, you know, if your meal gap is more, or if you take too much of spicy foods, and if you do not follow a scheduled diet plan, you may get this one gastritis.
Okay.
But there is not such evidence are not there. But this amla contain vitamin C. But another thing is that you have to see that it is citrus fruit is not recommended in
question was,
antigen.
can it be mixed with honey and can be taken? Because we have another call, so can you please just answer about that?
Yeah, that is that you have to see how much your gastric reflux is.
Okay.
If someone is not,
upon that.
yes, depend upon that, because we do not recommend citrus fruit in diabetic, in gastritis patient. So in that term, if Mrs. Bornali is not having any such issues after taking the amla juice, then she can go with that.
Okay, I'm sure Ms. Bornali, you have got your answers because you have just asked about the gastritis. This was not the topic we are discussing today, but I'm sure you must be relevant with what the answers you wanted to. All right, we have another call, Tina, so we'll just check out who is that. So hello, who's calling?
Hello, this is Pallavi.
Yeah, hi Pallavi.
From Guwahati.
Yeah, hi.
Hello. Yeah, my question is regarding my husband. He's diabetic too. He's around 37 years.
37 years, okay.
Diabetes 2, okay, type 2.
Type 2,
so,
right.
Yeah, so what is the diet that he should follow? And recently I had gone for some urine test where some traces of protein was found.
Okay. So you wanted to know about the diet?
Yes, diet and like it's always 150 fasting and 200 something after food.
Okay, okay. So you got the question?
Yeah, I got it.
Okay.
As I have,
thank you so much.
Yeah, as I have already said that we make the diet chart depending upon the height and weight, and as she has already mentioned the age, so I cannot now prescribe, that accurate diet chart, but she can come and see me in Excel Care Hospital always.
Okay. At least for the basic thing.
Yeah, basic thing I can tell to her that early morning you can take whole wheat is better for diabetic patient because it contains fiber, and you will not feel hungry for a longer time, and there will not be chances of hypoglycemia. Then can go with multigrain atta or can have dalia oats. They can prepare some multigrain atta roti at home also, like they can prepare with oats dalia powder incorporated with atta, whole wheat,
which is very easily
available. Easily can be prepared at home, and then can make roti, and with that she can give some protein rich food. It should be balanced, as I said. Only munching roti will not do, because from the roti she will give carbohydrate only, but with roti she has to incorporate with a glass of skim milk, and with that can have ghugni type of things like dry beans, a ball of dry beans that can be given with that, and
because little bit variations is also very
important.
Right.
And while preparing the dry beans, she can incorporate some vegetables in it, so the taste will be different. And in mid morning, maybe a bowl of fresh cut fruits, or thin lassi can be given, or fresh lemon juice, and then proper lunch. That rice, dal, vegetables, and if non-veg, then fish and chicken can be taken, but the chicken should be lean part of the chicken, not the with the fatty, and the preparation should also be in less oil.
So I'm sure the viewer who have just called and just asked the question must have got all the answers. So thank you, Tina. It was really having a good conversation, but we are really short of time, and we will continue our conversation. Maybe we'll take up this topic in our next episodes as well, because this is a very important topic which we see in every household these days. So thank you, Tina, for joining to Good Life, the health show. And I'm sure the viewers who have just joined us and just watched our show must be benefited with all the answers which our doctor and also our nutrition expert Tina has given. But with this, we have come to the end of the show. We hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues as well. So if you have any queries, to join us next Wednesday at 3:30 p.m. live. We will be there. Our numbers will be flashed on the television screens, and you can call us and ask your questions, and our doctors and nutrition expert will be here to solve out all your queries. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.